Chapter 33 is talking about nursing care of patients with upper gastrointestinal disorders. It's talking about anorexia. What do anorexia mean? What do
Loss of
anorexia?
appetite.
Or like the
Correct.
goal to stay under. Okay.
Anorexia literally means loss of appetite. When patients are experiencing anorexia, what are some things that you should monitor as a nurse?
Weight.
Yeah, we can monitor weight. And the information down here, we want to monitor intake and output. We want to monitor what you're taking in, what you letting out. We want to monitor your vital signs, because if you experience an anorexia, it may start affecting your vital signs because you aren't eating. Let's monitor your electrolytes. You know, so it's multiple things to consider monitoring when your patients experience anorexia. And then it talks about nausea and vomiting. When your patients are experiencing nausea and vomiting, we want to try to figure out, are there any triggers? Is this something that's triggering this? What are the triggers? What is the cause? That type of thing. And if pharmacological intervention is needed, you know, you want to administer whatever medication that's ordered to prevent the nausea and to prevent the vomiting. And it talks about some therapeutic measures for nausea and vomiting. We do want to give antiemetics and an anti-against emetics vomiting. Some people like to take herbal medication, you know, take ginger, where ginger helps with nausea and vomiting. I know my auntie, as she been aging, she complained of a lot of abdominal issues. So her favorite thing to drink is ginger ale. Will vomiting result in a metabolic or respiratory issue? Would that result in a respiratory or a metabolic issue?
Metabolic.
It would result in
Metabolic.
Definitely. And then even with it talking about ginger, where some patients may decide, hey, I'm gonna take ginger since I'm experiencing nausea and vomiting, in which you know, you consider ginger like an herbal med. Is it important for our patients to report when they are taking herbal meds or over-the-counter meds? Should they report that?
Yes.
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 Yeah.
Why is that important?
It may interact with the medication that they're taking or giving.
Definitely. That's exactly why it's important. And for your patient who's vomiting, what are some nursing interventions you can put in place for them?
Would you increase fluids?
Yeah, if it's not contraindicated, we want to increase your fluids. And if you can tolerate it. Increase fluids. We want to elevate the head of your bed. Or we want you to lie on your side to prevent aspirating. That type of thing. We want to encourage foods that you actually will eat. But sometimes when you experience nausea and vomiting, the smell of this about to make me throw up, you know, the thought of this about to make me throw up. Well, what would you prefer? What would you prefer? That type of thing. And it's talking about obesity. With obesity, we know obesity contributes to several preventable diseases. Obesity definitely contributes to several preventable diseases, hypertension, heart disease, cardiovascular disease, those types of things. And we know that with obesity, our BMI is an indication of health status. Will somebody read this particular paragraph where it say obesity?
Obesity is caused by a caloric intake and exceeds energy expenditure. Having a large waist results in an apple-shaped body. This is associated with greater health risks, especially for heart disease and cancer. This type of fat is referred to as visceral fat, which is metabolically more active. The metabolic activity increases substance such as I don't know that word.
Triglycerides.
Triglycerides, low density lipoprotein,
Lipoprotein.
lipoprotein. I'm sorry, I didn't see that. LDL, cholesterol, and serum glucose, and contribute to health risks.
What is LDL?
It said lipoprotein.
No, go ahead.
Yeah, but what impact do it have on the body?
Is there like more fat or something?
It's a bad cholesterol.
Okay.
It's a bad cholesterol. And we spoke about this before, but LDL is low density lipoprotein, bad cholesterol. We want the bare minimum in our body. HDL is a high density lipoprotein. That's more so the better. It's more so better, a better form of cholesterol, and it also helps rid LDL. So LDL, we want low levels of that in our body. HDL, we want high levels of that in our body. And it's talking about bariatric surgery. And when bariatric, when you're hearing the word bariatric, that refers to seriously overweight or obese. That's bariatric. And there are multiple types of bariatric surgeries. It also has an illustration of the BMI from what is considered underweight, anything less than 17.5, normal weight 17.5 to 20, desirable is 20 to 25, overweight will be 25 to 30, obese is greater than 30. And it's just talking about some of the different surgeries to prevent obesity or to help a patient lower their weight. Talks about gastric banding, where a band is placed around the upper portion of the stomach. Gastric bypass surgery. Will somebody read the gastric bypass?
The Roxanne gastric bypass is a successful weight loss surgery that reduces stomach size and bypasses some of the small intestine, which reduces absorption of calories, causing weight loss. It is mostly done laparoscopically, but can be done as open surgery. First, a small stomach pouch the size of a thumb is created. This small pouch causes a quick, satisfactory feeling of fullness during a meal, which is the key of the success of this procedure. Next, the small intestine is divided and the pouch is connected to the lower part of the cut small intestine to allow food to bypass the lower stomach, duodenum, and part of the jejunum. Digestive juice flow is maintained and food enters the jejunum within 10 minutes of eating.
Okay. And it talks about some of the complications of bariatric surgery is nausea and vomiting caused by overeating or by not chewing food well, bloating, heartburn, staple disruption, obstruction, dumping syndrome is common, gout, gallstones, etc. So there are several complications that can result from gastric surgery or bariatric surgery. And some of this stuff, when patients do receive some type of bariatric surgery, because I had one lady where I was responsible for giving staff their TB test. And, you know, some people have to get a chest x-ray. So this one particular lady had to get a chest x-ray. And on her chest x-ray, you can see where she had a gastric band placed on her, around her stomach or whatever. So artificial equipment, that type of thing, it will show up on an x-ray. It's talking about oral health and dental care. And it's also talking about oral inflammatory disorders, aphthous stomitis, which is another word for a canker sore. And we know those canker sores can be caused from injuring your mouth, dental work, vitamin B12, iron, folate deficiency, toothpaste with sodium can cause those cankers. And we know those cankers can be a bit painful. It also can occur due to infection. It's talking about herpes simplex virus type 1 infection. Type 1, we pretty much consider it herpes that actually emerge above the waist. Type 2 is more so herpes that actually appear on the genitals. Acyclovir is an oral medication that can be used to suppress the virus, because we know herpes is a viral infection, so we have to give some type of antiviral. When patients have viral infections, we get antivirals. When patients have bacterial infections, we give antibiotics. Patients have fungal infections, we want to give an antifungal. We cannot treat a bacterial infection with an antifungal or antiviral. We cannot treat a viral infection with antibiotics. I remember when COVID first started, a lot of the doctors were diagnosing the patients with pneumonia. And I remember at one point, it was actually like a month before COVID started in February, where I was working at a facility, everybody was taken sick, and the doctors was diagnosing all them people with pneumonia. And I'm like, oh my gosh, I just can't believe that we got so many patients. I've never seen so many patients with pneumonia. But the thing for me, by the doctor thinking it was pneumonia, doctor giving these patients antibiotics, where I'm like, you know, days passing, I'm like, these antibiotics ain't helping nobody. Something else is going wrong with these people. But you know, it was COVID or whatever. And COVID is a viral infection. So antibiotics will not treat anything viral. Antibiotics will only treat bacterial infections. And it's talking about oral cancer. And with oral cancer, a sign of it may be a sore that does not heal in the mouth after 2 weeks. Patients may report difficulty with chewing, swallowing, or speaking due to the fact of having oral cancer. The way to diagnose it will be a biopsy. Patient will need biopsy to actually diagnose it. And you know, some of the common cancer treatments will be offered: chemotherapy, radiation, as well as surgery. And it's talking about common concerns in oral health and dental care, where it's talking about antibiotic prophylaxis. Will somebody read that paragraph or sentences? Hello? Will somebody read antibiotic prophylaxis?
Well, people who have artificial joints or certain heart conditions may need to take prophylactic antibiotics before certain dental procedures. This is to prevent bacteria from entering the circulation and causing bacterial endocarditis. The patient's healthcare provider identifies the length of time after a joint replacement for 1 or 2 years or for life that antibiotics are required. The dentist is informed of the patient's history to prescribe appropriate antibiotics.
And make sure y'all reread this because this is critical. This is something y'all will be tested on. This is information that will pop up when you sit for your state board. So you want to review antibiotic prophylaxis. And when we are giving patients medication prophylactically, it can be to a point where, just to say you went, doctor had to insert a urinary catheter. They inserted a urinary catheter and they feel like, hey, somehow a germ may have entered your urinary tract. So to prevent you from developing an infection, we're going to just start you on antibiotics. So prophylactically, patients can receive prophylactic treatment, although I don't have an infection, to prevent one from occurring due to whatever procedure we did. We're going to go ahead and give you antibiotic therapy prophylactically. And it talks about thrush, where patients have thrush in their mouth, that white tongue, that type of thing. When patients do have thrush, which can be caused by multiple things, the treatment of choice would be nystatin. Nystatin is a medication that the patient rinse around in their mouth. After they rinse it around in their mouth, you need to get them some water to rinse that nystatin out their mouth. So anytime a patient is prescribed nystatin, give them something to rinse their mouth out. And it talks about esophageal cancer. With esophageal cancer, how do you feel like that would present? Right now you got esophageal cancer. How do you feel like that would present?
Like they had difficulty swallowing.
And why is that?
Because it'd be like,
you got a tumor growing on that area. And if you have a tumor growing on that particular area, it's going to affect that area. Somehow it's going to affect the esophagus. And the thing that I think about with cancer, wherever the cancer is growing, you know it's going to have some type of impact on that area. So that dictates the signs and symptoms of cancer that you will actually see or observe. So it just depends on where the cancer is growing. If cancer growing on my lungs, at some point it's like, oh my gosh, I barely can breathe, or I'm always coughing. You know, that type of thing. It just depends on where the cancer growing that dictates what signs and symptoms will be recognizable. And as you see, this patient had a suction drain. So this patient had to have some type of surgical procedure. And the reason they inserted a suction drain is because they know fluid, or it's anticipated that fluid will actually accumulate in this particular area. So we're gonna put a drain in this area so it can drain all that fluid right on out. And with esophageal cancer, one of the concerns is airway patency, making sure that the patient can breathe comfortably. If you got a tumor growing on your esophagus, you know that can press up against your trachea, where it can affect your breathing. We need to manage their pain. We also have to consider this patient having difficulty with swallowing. So we need a speech language pathologist to come see this patient. Is the patient current diet appropriate? Do we need to change the texture of this patient diet? Or do this patient need to be placed on some type of feeding tube until the patient condition improve? That type of thing. Several things you want to consider when a patient is telling you they're having difficulty with swallowing. Nurse, I barely can swallow. Nurse, whenever I chew up my food, it still feel like it's just sitting in my chest. That type of thing. And it talks about a hiatal hernia. And that's where the stomach protrudes into the diaphragm, into the chest. The stomach protrudes into the actual chest. Will somebody read signs and symptoms of a hiatal hernia?
So small
Small
hernia.
hernia. Go right ahead.
Go ahead. I was about to say you can go ahead.
A small hernia may not produce any discomfort or require treatment. However, a large hernia may cause pain, heartburn, a feeling of fullness, or reflux, which could injure the esophagus with possible ulceration and bleeding.
Mhm. And it just show you how a hernia can look, where this is how the normal esophagus looked, stomach, that type of thing. But with a hernia, somehow a protrusion from another organ began to occur. This is a protrusion from another organ that begins to actually occur. And some people do require surgical intervention for hernias. What position do you feel like you can best see a hernia?
When somebody laid flat.
Definitely, that's the position where you really can see that hernia, when the individual is lying flat. Yeah, but sometimes for hernias, you know, if it's to a point you had a hernia, it's not affecting anything, you just gonna live with it. And sometimes surgical intervention is necessary for a hernia. Now I was talking about gastroesophageal reflux disease, short for GERD. And GERD, it is the result of the esophageal sphincter not closing tightly. And you know our esophageal sphincter, so if this is the esophagus, you know, you got your head, you done swallowed your food, it passed through your esophagus. At the bottom of the esophagus, you have the esophageal sphincter. And you have sphincters in other areas of the body. And the sphincters kind of work like a valve, where it just open and close, it open, it close. And some people's sphincters tend to stay open, or it don't close all the way. And different things can contribute to that. Cigarette smoking can contribute to having ineffective sphincters, that type of thing. And with GERD, it's more so to the point when patients eat certain foods, they lay certain ways, that type of thing, where that acid is coming back up. It's coming up through your esophagus, and it caused that burning sensation, that type of thing. So it tells you some of the signs and symptoms of GERD is heartburn, 2 to 3 times weekly, regurgitation, dysphagia, hoarseness, sore throat. Therapeutic measures, again, cigarette smoking do contribute to GERD, so avoid smoking. The patient needs to have the head of their bed elevated when they are experiencing GERD to prevent it. And it can be even to the point where having the head of your bed elevated where maybe you put some blocks under your mattress to keep the head of the bed elevated, or multiple pillows, that type of thing. Antacids can be taken. Histamine receptor antagonists can be given. And them histamine receptor antagonists is to dry out, kind of dry you out. Because histamine, more so, when I think of histamine, it brings like fluid to different areas. That's more so my thought with histamines. But a histamine antagonist is working against that fluid. And some patients are prescribed proton pump inhibitors, and then proton pump inhibitors can work to prevent acid production, or the acid production, because that acid coming up out the stomach is what contributes to more so the heartburn, the burning sensation, the sore throat, the hoarseness, because it's damaging tissue. Okay. Then it talks about Barrett's esophagus. Somebody read Barrett's esophagus, that first paragraph.
I'll read it. GERD can result in esophagus inflammation of the esophagus due to acid reflux. Over time, this can change the epithelium of the esophagus and lead to Barrett's esophagus. This is a precancerous lesion that puts the patient at risk for developing esophageal cancer. Barrett's tissue can be removed during a 30-minute outpatient endoscopic procedure using a, radio frequency, ablation?
Yes.
Okay. The Barrett system. Normal tissue returns and the risk of cancer is reduced.
Okay. We're going to go to esophageal varices. And esophageal varices is a medical emergency. Esophageal varices are dilated blood vessels in the esophagus. Their rupture can precipitate a life-threatening emergency. So you have dilated blood vessels that can possibly rupture. And if they rupture, patient can potentially bleed out. So it's definitely a medical emergency. It talks about gastritis. Gastritis, anytime we hear itis at the end of a word, we automatically know it's inflammation. So acute gastritis, some type of issue that just emerged that causes that's causing inflamed stomach. Inflammation results in edema of the tissue, and it also can contribute to possible hemorrhage. And typically with gastritis, patient probably will present complaining of abdominal pain, nausea, vomiting, that type of thing. And it just talks about some of the common causes of an inflamed stomach. And we just read that certain medications can contribute to GI upset, such as the acetaminophen, which is Tylenol, NSAIDs, non-steroidal anti-inflammatory drugs can contribute to gastritis, the inflammation of gastritis, smoking, stress, etc. and even infection can contribute as well. And it talks about chronic gastritis. We know when something is chronic, it's progressive, it will continue to worsen. And it's been an ongoing issue for a long period of time. It's talking about peptic ulcer disease. Somebody read the first paragraph for peptic ulcer disease.
Peptic ulcer disease is a condition in which the lining of the stomach, pylorus, duodenum, or the esophagus is eroded, usually from infection with H. pylori. The erosion may extend into the muscular layers of the peritoneum. Peptic ulcers occur in the portions of the GI tract that are exposed to hydrochloric acid and pepsin. The erosion is due to an increase in the concentration or activity of hydrochloric acid and pepsin. The damaged mucosa is unable to secrete enough mucus to act as a barrier against the hydrochloric acid. Some individuals have more rapid gastric emptying. When combined with hypersecretion of acid, this creates a large amount of acid moving into the duodenum. As a result, peptic ulcers occur more often in the duodenum. Ulcers are named by their location. Gastric or duodenal ulcers are more common than gastric ulcers.
Okay. And it just tell you, so if a patient has a peptic ulcer that's caused by H. pylori, what will a treatment option be? Because H. pylori is automatically let me know patient that the peptic ulcer is caused by infection. So what would the treatment option be?
Antibiotics.
Antibiotics. H. pylori is a bacteria, a pathogenic bacteria. So we know that treatment for a bacterial infection will be antibiotics. We definitely about to give you some antibiotics. Based on reading this or whatever, I know that this patient will require antibiotic therapy. What else would this patient require? What other type of medication will we give this patient with peptic ulcer disease?
An antacid.
That might be possible. What else? What about the patient is experiencing pain? Do we give a patient something for pain?
Yes.
Yeah, patient
Yes.
experiencing pain. You want to look at the big picture. Hey, this patient presented with peptic ulcer disease. We ran tests. We know it's caused by H. pylori. Patient having pain. We want to treat the pain. We want to treat that infection. We want to treat everything we're supposed to treat. Okay. And typically, signs and symptoms of peptic ulcer disease or gastric ulcer is burning and gnawing pain. And it can increase with food ingestion or 1 to 2 hours after a meal. And it talks about duodenal ulcers can cause a cramping or burning pain. And anytime I hear the word ulcer just makes me think of an open sore. That's what that makes me think. So off rip with reading this peptic ulcer disease, just by hearing ulcer, I'm automatically gonna think of an open sore. And with an open sore, you know, right now, if you got an open sore on your arm, you pour a little hot sauce on it, burn it. You got an open sore on your arm, a little salt on it, burn it. That type of thing. If you have an ulcer in your GI tract, you want to still eat your fried chicken with a little hot sauce on it, yeah, you're gonna be burning a little. That type of thing. You want to put extra salt on, gonna burn a little vinegar on it, you're gonna burn a little. So that's what the ulcers make me think. So some of the same things that can occur on the outside of the body, you want to picture what it can do on the inside of the body. That type of thing. But make sure you know ulcer make me think of open area, an open sore. And with the ulcer, what lab value may concern you as a student nurse? What lab value will concern you? I see hematocrit and hemoglobin sticking out. Why would the hematocrit and hemoglobin be a concern? So when I think of an ulcer, and right now, just to think of your arm, you got a little ulcer in your arm, you know, and you realize, oh my gosh, I got scant bleeding, you know, where you bleeding. Only difference is with it being on the arm is that we can take a Band-Aid and put a Band-Aid over it and add some pressure to stop the bleeding. To have an ulcer in your stomach, it's nothing to stop the bleeding. You're just gonna bleed if you're bleeding, right? So my concern as a nurse would be the patient hematocrit, the hemoglobin, the red blood cells. Let's make sure patient is not losing too much blood, which may result in a need for a blood transfusion, or make sure the patient isn't losing blood, but we need to start them on iron pills. Okay. What is the nursing diagnosis for a patient with PUD? Your patient had PUD, what is the nursing diagnosis for that patient? So we know the patient is at risk for bleeding. We know the patient is at risk for pain, that type of thing. Patient may be deficient in knowledge about the disease process, so patient will require some education. And it just talks about a biopsy is the most conclusive test for H. pylori. Peptic ulcers are diagnosed on the basis of symptoms, upper GI series, which will be a barium swallow or endoscopy. And therapeutic measures, we want to get a patient histamine receptor antagonist to block H2 receptors to decrease acid secretion. So again, I told you, whenever I think about histamines, I think about histamines bringing moisture to the area. But with PUD, we want to give out a histamine antagonist. That's to stop that moisture. That's to stop the production of acid secretion, because that acid is what's going to contribute. That's where those symptoms are coming from, or some of them are coming from. And it just talks about medication regimen, examples for H. pylori infection. And we already talked about the patient need antibiotic therapy due to having a bacterial infection. And then it talks about a perforated ulcer. What they mean by that?
A tear or something?
It's kind of like a puncture, to say something like that.
Okay.
A hole, yes. Where that can be considered a medical emergency.
Okay.
It talks about gastric bleeding. And with gastric bleeding, if a patient is bleeding in a stomach, the blood can be hidden. And when blood mixes with hydrochloric acid and enzymes in the stomach, the blood looks like a dark granular material. And that's why a lot of people say it looked like he throwing up coffee grounds or whatever, because it looked more so like coffee grounds if you are bleeding in your stomach and it's mixing with the acid, enzymes, etc., and you throwing it up, it looked like more so coffee grounds. And gastric bleeding can result in hypovolemic shock. Why would that result in hypovolemic shock?
Because your fluids will be low, you're losing too much fluid.
Yeah, you're losing too much blood. So if you're losing too much blood, you're losing blood volume. And this just talks about for gastric bleeding, a diagnostic test would be to utilize an endoscopy and look at them lab values where we would anticipate patient having decreased hemoglobin and hematocrit levels. And it actually state the therapeutic measures. It talks about gastric cancer. Will somebody read this paragraph for gastric cancer?
Gastric cancer refers to malignant lesions found in the stomach. It is more common in men than in women. H. pylori bacteria can play a role in gastric cancer development. The antioxidants in fruits and vegetables can protect these cells. Other factors that may be associated with gastric cancer development include pernicious anemia, exposure to occupational substance such as such as lead dust, grain dust, glycol ethers, or leaded gasoline, and a diet high in smoked fish or meat. A poor prognosis is often associated with gastric cancer because most patients have metastasis at the time of diagnosis.
And you see where it tells you smoked fish and smoked meats contribute to gastric cancers. Because a lot of people like smoke foods. A lot of things contribute to cancer. Even people who love to cook with a cast iron skillet, that type of thing, it contributes to cancer or whatever. So you want to look at a lot of things that are contributing factors to cancer. Of course, cigarettes is like the one of the top things that contribute to a lot of different cancers. Therapeutic measures for gastric cancer, of course, surgical removal of the cancer, chemotherapy and radiation can be utilized as well. And if you had to give a patient pain meds, how do you evaluate if the pain medication was or wasn't effective? If you're giving a patient pain meds, how do you evaluate if the pain medication was or wasn't effective?
Asking the patient what their pain level is now after giving the medication.
Definitely. That's what we do evaluate. Initially, you said your pain was a 7. So now 45 minutes passed and you had your medication. How do you feel now? Patients say their pain level is now a 5. Is the pain medication effective?
Yes.
Yeah, it's effective, but we might need to get them something stronger if the lowest they're going down to is a 5. And typically with IV pain medications, if we administer IV pain medication, we know that medication will work a lot quicker than a pill. So a pill, yeah, after 45 minutes, it may be effective. IV, you should be feeling something after about 10 minutes, 10, 15 minutes. Hey, how did that make you feel? You know, that type of thing. Okay. And it talks about dumping syndrome. And that is a complication to GI surgeries where patients may experience, did I just miss something? Complications of gastric surgery, it talks about hemorrhage, and we know hemorrhage is profuse bleeding. Copious amount of blood loss will be considered hemorrhage. That type of thing. Patient can die from it. It's a such thing of internal hemorrhage, external hemorrhage. External hemorrhage is where we actually can see it. Child, you are bleeding out. You've been shot, you've been stabbed up, you bleeding out, you hemorrhaging. That type of thing. Internal hemorrhage, we have heard of it, where, you know, granddaddy got an aneurysm, it busts, they saying he bleeding in his head. That's internal hemorrhage. You know, you can hemorrhage internally anywhere, and it will actually show. You may, you know, person have some abdominal bleeding where they're hemorrhaging. It may start to swell on one area and may look darker on that one area. And of course, the vital signs will begin to change if an individual is hemorrhaging. Initially, what do you expect the vital signs to do when your patient is hemorrhaging?
Low blood pressure.
Go up.
There you go. That blood pressure is going to drop because the patient is going into hypovolemic shock. They're working their way to hypovolemic shock. And what about the heart rate?
Low pulse.
It's going to increase.
Initially, the heart rate will increase. Why is the heart rate increasing?
Is it because it's like working overtime to keep up with what's going on?
Yeah, to say the heart rate is increasing to to try to pump blood to those organs. The heart rate is increasing, working so much harder to try to get blood pumping to those different organs. Okay. And it talks about gastric distension. Gastric distension, we need to figure out what's causing the distension, that type of thing. And once we figure out what's causing the distension, we can move forward with therapeutic measures. And it also talks about dumping syndrome. And dumping syndrome, somebody read that paragraph for dumping syndrome. Let me pull it up. Paragraph. Yeah, somebody read the dumping syndrome paragraph. Who haven't read that today?
Which paragraph did you say?
Dumping syndrome.
Dumping syndrome. Dumping syndrome is one of the most common complications of gastric surgery. It occurs with the rapid entry of food into the jejunum without proper mixing of the food with digestive juices. On entering the jejunum, I can't really see that. I can't see it. Food draws extracellular fluid into the bowel from the circulating blood volume to dilate the high concentration of electrolytes and sugars. This rapid shift of fluids decreases the circulating blood volume and produces symptoms. The symptoms occur 5 to 30 minutes after eating. They include dizziness, tachycardia, fainting, sweating, nausea, diarrhea, a feeling of fullness, and abdominal cramping. Additionally, the blood sugar rises and excessive insulin is exerted in response. The release of insulin causes the patient to have symptoms of hypoglycemia about 2 hours later. The symptoms include weakness, sweating, anxiety, shakiness, confusion, and tachycardia. The patient should immediately eat some candy or drink juice containing sugar to relieve the symptoms. See nutrition notes for ways to reduce dumping syndrome. Inform the patient that these symptoms may last for up to 6 months after gastric surgery, but usually slowly subside over time.
Yep, so dumping syndrome is huge. Make sure you all develop a clear understanding of dumping syndrome. And typically, the symptoms of dumping syndrome occurs mighty fast after a patient eat or whatever. So make sure you review that information. It talks about pernicious anemia, which is a complication of gastric surgery. If you were to get a portion of your stomach removed, that type of thing, it can result in vitamin B12 deficiency. And we know vitamin B12 deficiency causes pernicious anemia. And it talks about steatorrhea, and we know that that is where your stool looks like it's fat in it. It occurs when your body isn't breaking food down adequately. And if your body isn't breaking food down adequately, that will result. Pyloric obstruction. We know the pylori is at the end of the stomach before the duodenum and small intestines. As obstructions increases, it gradually becomes more difficult for the stomach to empty, and then symptoms emerge. Symptoms will worsen. And let's look at a math question. I'm trying to think of one. So a physician ordered for a patient to receive 1,000 mLs of normal saline over 4 hours. How many mLs would the patient receive per hour?
Wait, say it again.
Physician ordered for a patient to receive 1,000 mLs of normal saline over 4 hours. How many mLs would the patient receive every hour?
250
250
250 what?
ml.
milliliters.
ml.
Because you all started med math this month. And with med math, make sure y'all careful with them. What word am I looking for? That you are putting the correct measurements behind, if it's an ml, cc, drop, etc., that you are including that information.